wear a mask, and wash your hands. Follow the guidelines. This is a call to serve one another in order to save one another. Thank you. Governor Pritzker, questions and answers.
Thank you very much, Doctor. Happy to take any questions from members of the media. Yes, ma'am.
I know no indoor dining for bars and restaurants in the county that we need. Are there any other restrictions for gyms, churches, synagogues, schools that are private schools and that have already started hybrid learning?
Remember that all of the existing mitigations under Phase 4 of our Restore Illinois plan, those remain as they are. These are resurgence mitigations for areas where the positivity rate has gone up or where they've tripped other metrics, and that's where indoor dining, indoor bar service are being temporarily halted, and where we're reducing the number of people who can gather from 50 to 25. But you can find all of the mitigations that are associated with the resurgence mitigations, Tier 1, Tier 2, and Tier 3 on the IDPH website.
Governor,
yes, ma'am.
Dr. Zika, too, would weigh in on this. Yesterday, Dr. Arwadi spoke to worried about gatherings within the home.
Yeah.
And they also, the city, you all contradicted each other. So the city saying the spread is going on within the home, and that restaurants and bars, they're not necessarily seeing that in their contact tracing. Is the state seeing that the spread is going on because of bars and restaurants being more open?
Yes, and there are pages and pages and pages of studies from around the world, from around the United States, not to mention articles that in fact, I most of the media, if you would like them, happy to have my press secretary send them as well. I mean, literally talking about piles of these studies that show that bars and restaurants are spreading locations, significant spreading locations. It is also true, though, and I want to commend Dr. Arwady for saying, as she did, that private gatherings are another major spreading opportunity for the virus, something that we all need to be very, very careful about. It's not so much your own family that you're living in a pod with every day as it is when you're inviting either other family that don't live with you, friends over. I'm not saying you can't do that. All we're saying is, as Dr. Ezike said the other day, that maintain social distance even when you're having friends over. It's okay, 6 feet is not that far. Wearing a mask when you don't know them, that they've been tested or that they're COVID free. It's an appropriate thing, making sure that people have hand sanitizer available to them, that they wash their hands, etc. These are all things that we're going to have to get used to, especially during this winter season, especially during the holidays when we know we all want to get together with our friends and family.
Governor, if I may
Yes, ma'am.
ask you, understandably there's a lot of frustration coming from different quarters in those regions that are being rolled back again, especially
Yeah.
7 already went through this a couple of months ago.
Sure.
Just a short while ago, I was speaking to one of the state reps that was on the call with Dr. Ezike earlier this afternoon, where she was telling them about this rollback. The point that she was making was this. She said that on the call, as Dr. Ezike had mentioned, that bars and restaurants account for the lowest number of cases in the current surge. And so if they're at the bottom of the list for these new surge, why are we affecting businesses? Why are we rolling them back when maybe the benefit from it won't really be what we would like to see?
I have my own thoughts, but I want to let Dr. Ezike answer for what.
I just want to make sure that I wasn't mischaracterized. Maybe you can hear me. So the issue is, on the call earlier today, they wanted to say, why do we keep going after bars and restaurants? And so as we look from region to region to region, statewide data, we look at the places, this is again from our contact tracing efforts, we have the individuals who have talked to the case. And then the questions include looking back where they have been in the previous 14 days. That is where, those are the places that they have been where they could have caught the virus. And then we also look forward to since they've been symptomatic where they've been. So that's the place that they could have given the virus to, and exposed others. And so when you look at the top 3 places that come up over and over, region to region, statewide, it comes up as people's workplace, it comes up as school, it comes up as restaurants and bars. So we're not going to not have people go to school. We're letting the local health departments and the school administrators decide for themselves what's appropriate regarding school. And then in terms of workplace, there are people that you cannot work from home or you have to go to work. So the next thing that we can actually act on is the bars and restaurants. Okay.
Well, how might this affect the number of people in the classroom though? Because if the rule is now 25, are there any classrooms that have more than 25? What should they do?
Yeah, so again, the rule for the class, and this is not supposed to be for schools specifically, but I know even as we worked so closely with the schools and the local health departments over the summer, that in the classroom they're supposed to be spaced out, the 6 feet, and masked. And so depending on the the classroom, they can figure out how many people they can fit. But we've already accounted for and expect that there's 6 foot of distancing and masking in the school setting.
Yep. And there are guidelines, let me just add that there are guidelines, as you know, that were provided to all the schools from the State Board of Education to make sure that schools know what they should be doing. But as I've said all along, that schools are different locations from one to another, even within a school district, as you know, putting Chicago aside for a moment. Outside of Chicago, there are many, many schools, multiple schools in a school district, and they're all laid out a bit differently. Some of them have many fewer students than the next school that's in their school district even. So we want the schools to make decisions about how to space people out, how to make sure to keep them safe within the school. But our goal, our number one goal, is to make sure that we get our kids back into school as it is safe. So hybrid learning, a good idea, and of course in-person learning, a good idea. Again, at the local level, school boards and school administrators making decisions to keep those kids safe.
How might this impact your decision on winter high school sports? If this is what's going on as far as more restrictions, might we see high school sports for the winter being played?
Well, let me begin by reminding you why we're here 2 days in a row and why we're now having a daily press conference about COVID-19 again. And that's because we are seeing a national surge of cases that is affecting every state around us in a dramatic way. And in Illinois, we are seeing the numbers go up literally all across the state. And so we are going to be very careful about whatever guidance gets issued for school sports for the winter, as we've tried to be careful about everything that we're doing so that we don't have a significant surge. Illinois has done a better job, I think, than most states, certainly the ones surrounding us, and we'd like to keep it that way.
The CDC changed the rules. I think Dr. Zika talked about this. We're now taking into consideration antigen tests, which are rapid tests. Why now are antigen positive cases being added now? And do you think that has to do with the increase in cases, not just in Illinois, but nationwide?
I don't know about nationwide. I can tell you what's going on in Illinois. Let me start with this. We already have a robust testing system that didn't have antigen testing in it. That's because the percentage of tests that are being done that are antigen oriented up to now have been very, very small. I think you can see, I think we announced that it was something like 1,000 or 1,200, out of the 50 or 60, 70,000 that have been announced over the last couple of days. The reason that we're now including antigen testing is because we're now getting resources from the federal government that are antigen tests. And we want to be able to use those tests for surveillance testing, which is a very important thing for us to be doing in the state. And so we want to, and we'll be reporting those. But we've separated them out. People can see the numbers of antigen tests. Right now, it's a very small percentage. I think 1% to 2% is the total number out of all the tests. What's that? We are. We'll be. You'll be able to see. Yes, you'll be able to see it. I don't know whether we've got it up on the website yet, but that's the point of it. Is we want you to be able to see the separate tests, but we also want us to be able to calculate the positivity rate using these tests because they're useful for surveillance testing, which is part of how you get to a positivity rate.
Can we foresee another stay-at-home order?
I'll come over here in a moment. I promise. Yeah. Go ahead.
Do you foresee another stay-at-home order, and if so, what will it take to get there?
It's not something that we're considering right now. As you know, we have this resurgence mitigation plan in place. It's been working as regions have gone in to the resurgence mitigations. They've been able to lower their positivity rates and come out of it. It takes a little longer for some regions than others for reasons I can't explain, but they do come out of it. So we're going to continue with the plan that we're on. That's a regional plan. Yes, ma'am.
Just go back to the question that I asked earlier and didn't get no response on it.
But we are seeing the benefit. In fact, we saw it in Region 7. We saw it in Region 4. Those are 2 regions that we put into this very same set of mitigations where we limited or actually eliminated temporarily indoor bar service, indoor dining. Those were 2 of the things, limited the amount of people gathering. And you saw those positivity rates come down in both of those regions. So it does work. And indeed, it is an area of spread, as Dr. Ezike did say. And we are seeing it in our contact tracing. So, this is an important area to focus on. Look, this isn't about punishing anybody. We're not focused on, we didn't pick it just because it sounds good or that we want to do it. It's because all the studies that have been done about bars and restaurants show that these are significant spreading locations. And we want to stop the spread. We want to slow the spread as best we can. And so we're putting mitigations in on a targeted basis to make sure that we bring down our positivity rates so that those businesses can reopen to indoor service. That's our one right here. We haven't taken a look.
Yes, thank you. We talk about COVID fatigue, for months and months and months we've been telling people, wear your mask and don't have parties. And at some point that starts to become white noise. Do you feel, each of you said, wear a mask, keep your distance. Do you feel like the current strategy is still working to get that message to residents?
Yeah. I do. And what I know is that wearing a mask works. What I know is that social distance works. Do I think that the messaging works? Sure. Look, there are a lot of people that have resisted because they didn't know anybody who had COVID. They didn't know anybody who got sick from COVID-19. There are a lot of people that aren't paying a ton of attention. They, of course, turn on the TV, they hear about COVID, and they say, I don't want to hear the bad news. The truth is that as time has gone on, lots and lots of people have come to know somebody that got COVID-19 and got sick from it. And I particularly want to, and I said this the other day, at the early stages of COVID-19 back in March and April, I think there were many people who lived in rural areas of the state, who didn't see many cases, and they didn't see many people getting sick. And they looked at Chicago and Cook County and the collar counties and said, that's a problem for them. That's not our problem. We don't need to change our lives. And so for several months, there were people that resisted wearing masks. They weren't really listening to it because it wasn't affecting them directly in their communities, or seemed not to be. That situation, to some degree, has reversed. That is to say that Chicago has one of the lower positivity rates in the state, and it's the rural areas of the state that have the highest positivity rates. You're seeing that in Wisconsin. You're seeing that in Iowa. You're seeing that in Indiana. And so we need to make sure that people hear the message again, because now I think it's personal to people. It is local to people. They do understand it. And when they hear from a local doctor, when they see that their local hospital is getting fuller, when they know people who are getting sick from COVID-19 and having sometimes long-lasting symptoms, I think then it's real. It's more real to people. And so, yes, I think that although people feel fatigue from all of this, and I know we'd all like to go back to the lives that we were living before we ever heard the words COVID-19, the truth is that we're going to have to tough this out for a little bit longer. We do see progress on vaccinations. We do see progress on treatments. And I'm very, very hopeful that in the spring, that more and more people will have those things available to them.
What does this mean for the Joliet Casino? It is Will County's largest employer.
So the same rules for every region that goes into these resurgence mitigations. They have to close by 11 p.m. And they're under the same. That's another one of those under the list of Tier 1 mitigations under the regional resurgence mitigations. So there's some mitigation there as well. Sorry.
Only 25 people inside, or?
I can't remember the exact terminology that's in the resurgence plan for casinos. My apologies. There's a lot of detail in there, but I can at least tell you that they too are going to have to make some changes to the way they do business. Thank you.
Thank you.
And the bars and restaurants.
Jordan, can you mail out the advanced email to bars and restaurants? The studies? Yes, that'd be very helpful. Thank you.
Oh, yeah, no, we gotta do it now, then you're ready. Oh, yeah.
The health department just released them. Restaurants is 49 as opposed to nursing
the call is, whether it's simply a suspicious person call or whether it's a crime in progress. An example I can give.
Sorry,
Yes,
a non